Welcome to The Age Guide, the podcast where we give voice to older adults and caregivers, challenge ageism, and offer guidance to help you thrive on the journey ahead. I'm Gretchen, your host. This season, we're diving into what it really means to age well, from keeping our bodies strong and our minds sharp to nourishing ourselves and building more inclusive and connected communities. Our guest today is Dr. Israel Cross, President of the National Aging in Place Council, to talk about systems of support as we age. Dr. Cross is a public health gerontologist and U.S. Public Health Service officer with more than 15 years of experience improving care for older adults and caregivers. Dr. Cross, thank you so much for joining us today.
Thank you so much for having me, Gretchen.
Can you tell us a little bit more about how you got involved in this work and with the National Aging in Place Council?
Yes, so I got into UMBC's gerontology program, which has a socio-cultural behavioral track. It just kind of made a lot of sense. And yeah, the educational part fell in place. And then I got a scholarship to work in the National Institute on Aging. Then I worked at CMS after that for a couple years. And then I guess you would say that the height of LinkedIn happened during COVID-ish.
Hmm.
So I started seeing what's out there, and at the time, it's just things just line up. Um,
Yeah,
my
yeah.
mother-in-law was living with us. She is living with dementia,
Mm.
and we have 5 kids. And I'm starting to think, well, how can we modify the house to have my mother-in-law stay with us longer, potentially have a part-time or full-time caregiver.
Hmm.
And that's when I started really looking at aging in place. Then I got a certification in aging in place, and then also went back to school again with USC, and I took their executive um, home modification certificate program, which was outstanding and opened my eyes to a lot of things. So, um,
Yes. So,
yeah,
speaking about caregiving, it sounds like besides all of your professional and academic experience as a gerontologist and now a nonprofit leader as well, but you've personally had on the ground experience as a caregiver. How does that role kind of influence your thoughts on what older adults really need?
yeah, it's a good question. I guess so. Also, my grandmother. Uh, She passed away. She also had dementia
Oh, I'm sorry.
during COVID, so that was a challenging time.
Mhm.
And the merge for me was I kind of jumped the gun a little bit, like studying aging, and you read the statistics, but when you're in it, it's just so vastly different. When you're asking the questions about, okay, well, how does somebody qualify for a nursing home stay? Is this the appropriate place to go? Then you start looking at ratings and reviews.
Yeah,
And
and
that
then navigating Medicaid and all of the
exactly.
payment things, right, that's a lot, and you're in the sandwich generation, you're raising 5
Right,
kids too.
right. And even working at the Centers for Medicare and Medicaid Services at the time, I didn't know A through Z about nursing home care, um, insurance things, like all the spinning down, the donuts. And I found that that's what's really missing for me was, being a caregiver, and on the other side is where are the resources? Where's that one source or website I can go to and find everything I need? It's not there.
Right, yes,
Yeah,
that's
so
hard to find.
yeah, that's something that, we try to do in the National Aging in Place Council, and I informally help anybody I can
Mhm.
and, collaborate, but it can be challenging. Again, especially when you have that you're just thrown into it like a emergency room visit, and that's what happened with my grandmother. She had an emergency room stay, ended up in a rehab facility, and even at that time, they didn't know it was dementia.
Mm.
And I kick myself sometimes in hindsight of the things I saw earlier in life that it didn't ring a bell. So it's just
And
about,
that the caregiver guilt, you gotta let that go. That's
yeah,
the right, I could have done more, what else should I but you were doing the best that you could with the information that you had at the time, and it's not easy, like you said, you get thrown into caregiving before you're really thinking about it, and you don't even realize how much you're doing, and it kind of builds as, the person you're caring for needs more and more, and you have
yes,
to all of a sudden step into making more decisions for them and helping them with all kinds of things, from those big decisions about where they're gonna live to the small daily activities that they need to get by, and that's really hard, and like you mentioned, navigating all of that, that's what's so tricky. And age guide is an area agency on aging, so we try to be that guide for people.
mhm,
That's right in our name, but helping people connect to those services. But like you said, you don't really know what you need to know until you get into it, and then all of a sudden it's like, okay, what resources do I know? So you may not have paid attention before
right.
to the things that are out there. So, what about this whole aging in place thing? What does that name mean, and why is that important?
I get that question quite frequently because we know as time goes by, phrases and words mean different things. And now I see the industry more move towards aging in communities.
Mm, uh-huh.
So I would say my aging in place definition now is more about an individual having more autonomy, choice, support to remain in a familiar environment safely and meaningfully. Um, it's not just staying in your house, as aging in place implies. It's staying connected to your community, purpose, and I think that's what's missing in a lot of aging in place advocacy work. It's not the house. It's not just the house.
Mm,
It's the community. It's transportation. It's finance. It's food. It's a lot of things, and that
right.
gets left out of the conversation.
Yes, I think you're right. And everything that you mentioned ties into connection. That social
Yes,
connection that's so important, right? So we want to age where we want to be, like you said, where we feel comfortable and supported, but we don't want to be isolated. We want to be connected to our community.
right. Absolutely. I I find that when people talk about aging in place, they they talk about, oh well, is it a rancher? Is it ADA accessible, ADA compliant? And those to me scratch the surface
Hmm.
um, with having you know aging in place or aging in community conversations. Again, it goes back to what you're saying: staying connected, transportation, someone to get you to your appointments or the grocery store, like all the simple things we think about. Um, Aging in the community looks different in rural versus the city. A lot of things you don't really think about until you're
Yeah,
there.
that's true. And you just published a new book out of the National Aging in Place Council, right?
Yeah.
Aging in Place Conversations, the Caregivers edition. So this
Yes.
ties in a lot of your early work as well. What are these conversations?
Yes. This is our third edition, and you'll find anything in there from someone's firsthand account of being thrown in or thrust into caregiving. You'll find medication management, deprescribing. Is someone taking too many medications? How do we get them down from that? I see that a lot, and it happened to me. Well, my grandmother.
Mm-hmm.
You'll find people giving tips, guidance, and support on staying safe in the house, bathroom safety, even down to non-slip showers. Um,
All those
there's
safety things.
exactly, and I'm just scratching the surface on the book. There's it doesn't have to be read front to back, chapter to chapter. You can just look at it and say, "Oh yeah, I'm only interested in this chapter that talks about what is this conversation I need to have with when is it time to take the keys away from, somebody you care for."
Those are some tough conversations. Yeah.
Yes, and that conversation I had to have with my mother-in-law, going through the driving assessment. This stuff is not easy.
No.
And also point of the book is, a lot of us that were authors were caregivers or are caregivers. So we
No,
kind of
good.
there's tones in there that's more factual, more tips, and there's tones where you, there's some stories, there's some here's what I learned in my experience. So it's a little bit of everything. And
Good.
again, it's that merging and resources. There's a lot of resources in there as well, QR codes. You can just, hold your phone over it in the book and get
Oh,
connected to
nice.
things. So really excited about this book. Actually, we talk about technology too. I know that's a hot topic now with like things like I don't want to say remote monitoring kind of things, but it kind of is. But yeah, I'm really excited about this book. Like, I
Hmm.
think it's time. Caregiving, I've seen take the national stage in the last few years. It was my pleasure to get that book out, and I really hope somebody can, even if you don't read the book, if you just see the title and think, you know what, maybe I need to have some conversations, then we've done our part. And
That's true.
yeah,
Yeah, you just think about like there's stuff we got to talk about, right?
exactly.
It's not going to go away, so got to address it. Got to talk about it. How does aging in place? You mentioned that it's different for everyone. How does that look different depending on, people live in such different communities, different folks have different kinds of family support. Some don't have any, some have a large extended family or living with family. How can that look different?
Yeah. So, like I said, like aging in your community might look different if you're in a rural area where maybe reliable broadband is an issue. In cities, accessible housing. I'm not saying all cities are unsafe, but
Hmm.
there's just practical things that come to the forefront depending on where you are. Distance from hospitals,
Okay,
clinics,
yeah.
doctors, distance
Hmm.
from uh, even good food sources.
Right.
Distance from community things, think like
Hmm.
the YMCA, the pool, the
Hmm.
anything social, bowling alleys, like
Senior centers, right.
exactly all of these things. You know, uh, I wouldn't say that they're commonly thought about. Um, and some people do these from a distance as best as they can. That's
Hmm.
actually another chapter in the book is caregiving from a distance.
Oh, right, because that's common. We run into that a lot with caregivers calling us in Illinois, and they live in another state, and they're trying to figure out the
Yeah,
system here. Mhm.
yeah. And then looking at community support, even your neighbors, like everything comes together when you're talking about aging in your communities, and it can look different based on where you live and your family situation. Some people are solo agers. It's just
Mhm.
them, their family, is not around and you're just out there by yourself.
Right.
It can be very challenging. So I
Yeah.
think just the more we can talk about these things. And I'm not even
Mhm.
talking about, I see it a lot now on LinkedIn, oh, this is a multi-billion-dollar industry. Let me show you how to tap into it. Like that's, you know,
So there's not
no,
gonna be a quick fix for this, right? It
no,
takes some difficult thinking and
yeah,
even though everybody's experience is different, I imagine there are some common themes that you probably address in this book and the other books that you've published about aging in community. Do you have any examples of what's working well to address sort of the commonality of wanting to age in community?
Yeah, absolutely. And I think part of it starts with just having the conversation that we mentioned. Like,
Mhm.
my mom has already told me what her wishes are. And, you know, even though my family's big, I definitely owe her that honor and right for her to have that. And
Mhm.
what you see happen sometimes is people don't have these conversations. So the caregiver sometimes has to do what benefits them the most, or they haven't had that conversation. And sometimes you're talking to someone who may have some cognitive impairment. So,
Mhm.
you know, I just encourage people to have these conversations early. Some things that are kind of working well. I would say the home modification, universal design piece is a slam dunk right now. You probably can't talk aging in place or without somebody mentioning a grab bar or a ramp, a 0-degree entrance, a
Mhm.
0-degree shower. But I want to say before I mention some other things, talk about grab bars. I unfortunately see these dangerous suction cup grab bars a lot of places
Ooh, I
and
see those all over too. Those are dangerous?
dangerous. You gotta have it like blocked and framed behind the wall. Yeah, so that's unsafe. Uh,
Yeah, that's a big one then.
right. I mean, I've slipped in showers before where it's slippery, so like
Yeah.
gotta have that. And I'm excited to see that a lot of the modifications are not clunky and look like so sterile and like hospital like
Yeah.
you can have these modifications in style. Like I'm seeing a lot of that. Seeing more training education online for caregivers, information technology, connecting people to resources. I think those things are working well. But everyone says, do XYZ before a crisis. I try to steer away from crisis language
Yeah.
because aging is not scary or a crisis. I
It's a
mean, if
natural part of living, right?
exactly, if I'm so blessed to make it to my 70s, 80s, I mean, I'm counting that as a win. So
Right,
it's
right. I
yeah.
agree.
And some of these examples I mentioned, you got to have the nexus of infrastructure and compassion. So,
Mm.
all these things that I talk about, they have to be practical, personal. You don't just go running making change without having conversations. And I think that gets left out
Mhm.
when, caregivers, either formally or informally provide assistance, they don't have conversations. It's just, hey, I'm helping and this is what it is. And that's not right, in my opinion.
Mhm. Yeah. Such a hard balance because caregivers also get burned out really fast and there's a lot of stress involved. They need to take care of themselves too. Do you have some conversations about that in the book too?
Absolutely. Actually, I'm also writing an article about caregiver stress, intergenerational living, caregiving. And
Oh.
I believe last time I checked, about 60% of caregivers work full time.
Yes, isn't that incredible? They're balancing so much, right? And they
Exactly.
need some flexibility in the workplace. We got to change some policies around workforce to support
Yes,
caregivers, right? Are
yes,
you with me on that, Dr.
yes,
Cross?
100%. And then you get, is it presenteeism or absenteeism? Both of them actually. So you're there, but you're so burnt out, you can't work at your
Focus.
peak capacity because
Right.
you're doing this, doing that. And a lot of employers just, you don't see the compassion or empathy there. And sometimes I don't wish this on anyone, but a lot of people's light bulbs don't go off until they find themselves there. And
Right.
uh, there's just a lot of things to think about, especially for the or the sandwich generation caregivers. Um, it's a lot of strain that can happen.
Yeah, and I think some of that just has to do with educating employers that you can hang on to this person if you provide a little more flexibility, let people
Yes,
take maybe a leave of absence or cut down their schedule a little bit or flex their hours so that they can be
yes,
available for their loved one during the day. Those kind of things actually save businesses tons of money in the long run because they don't have the turnover and people feeling like they have to completely exit the workforce. So I think
exactly.
we got to do some educating around that.
This absolutely has to happen. And
Mhm.
you know, you don't get the same treatment when you say your kid's sick or I got to take them to the but when it comes to older adults, I find that it's just different. People are so understanding when it comes to kids,
Mhm.
and that's a role that they understand. But when it comes to older adults, there's not as much.
That's interesting, and that could be partly ageism or just people not having as much exposure to that.
Yeah,
That's interesting. So, what does it take to support these caregivers and these folks who really want to age in place in the community? I imagine that there's a lot of coordination that would need to happen. We're probably talking about like high level systems change.
yeah,
We're looking at health providers and families and the whole community to sort of coordinate and make
yeah,
some changes.
yeah. I think you're right. You're right there. The communication piece. I found myself so many times. My grandmother, uh, she got uh, dismissed from at least 7 or 8 nursing homes.
Oh, no.
Uh, you find yourself upon discharge or kicked out that, okay, well, now what? Or after the
Mhm,
hospital, okay, now what? Uh,
mhm,
the the communication, once you're out of their purview, they're like, up, good, we're
mhm.
done. And I think too often we build care around institutions and facilities and not people.
Yeah.
Um, and providers sometimes they don't even know the name of the person they're providing care to.
Mhm,
And some like even if the caregiver manages most of the care, I think there's so much fragmentation that we see. Um, all these different data systems, siloed funding. I like that Maryland has the longevity plan, the
mm.
multi-sector planning. I'm seeing a lot more
Yeah, we're
examples
working
of
on
that.
ours in Illinois too.
Oh,
It's
really?
almost finished. Yep.
Awesome. Like if transportation and, education are both doing things when aging, why don't we both talk together and you
Yes.
do it like so? I'm seeing a lot more multi-sector planning, multi-state planning, and that's exciting. Getting out of the
Yeah.
silos, having the conversations, and I think when good coordination works, you see it almost immediately. Like
Mhm.
if you can get, I mentioned deprescribing, like the pharmacist, the family caregiver, care team work on medication management. You can sometimes get reduced hospitalization, improve adherence, peace of mind, oh, such and such isn't taking all these pills unnecessarily. And, I can attest that I had to do that myself. My grandmother was on a few um, black box FDA warning
Mhm.
antipsychotics, and I'm like, this isn't necessary. Like she was zonked. Like when
Yeah,
I would
then
go
there's all
see
the
her.
side effects and the interactions
Yeah,
with the other medication. You don't know why.
yep.
So
And
you
then
had
the
to work on kind of weaning that off. That's a good
exactly.
example.
It's scary and it's frightening, unfortunate, but um you got to
Yeah.
ask questions.
Right. We're all trying to navigate this. We can't all have PhDs in this. but we know best what we need for ourselves as we age, and we
Yes,
know best what our loved ones need. So we got to speak up. You're right. That's important.
absolutely. Advanced directives comes up.
Mm,
Um, Nobody likes to talk about, like, even when I was a kid, my dad would say, what he wanted, for his funeral and all that. I'm like,
everybody's like,
"Ah,
don't talk about that. We don't
right,
want to think about that.
right. But a baby's born. What color are we gonna paint the room? What are we gonna, it's
Hmm.
these are all stages of life. And that's why I like to talk about aging across the continuum, across the
Mm,
lifespan. And for me, the 65 plus thing, I would be so glad when we get that out of the door and stop talking about, oh, when does somebody become old, or, you
right.
know, this 65 plus baby boomer, this and that.
Hmm.
It's a continuum. And,
Hmm.
and these arbitrary silver tsunami things, like I don't like crisis. And oh
Hmm.
yeah, 65 plus, you're over the hill, you're frail, you're elderly. No, we have to stop that.
Right. I agree. It's really negating the impact that people can continue to have, and they bring their wisdom
Absolutely.
to it and their rich experiences. And people still want to be active if they can, and they want to be out there. They want to be working, they want to be
Yep,
contributing in some way. They still have their dreams and their passions. So we don't
absolutely.
want to just discount that. Yeah, you're right. And
And
just
they
say, oh, well, you've lived long enough. It's okay that you're sick now.
exactly. Yep. And I've
Mhm.
read articles that even say ageism starts as early as 3. And, I've like I said, I have 5 kids, 8, 6, a set of twins that are 5, and a daughter's 1.5. And I can attest that if I take too long to get off the ground, they're teasing daddy already,
Already, yeah.
already. And these things are even things I have to check in my own mind of,
Right.
aging. I'm bald, and it's like I have to, and it's fine. Like I have to check um those negative um ageist kind of behaviors, because we also know how we think about aging can impact our health. So
How
it's
long we
important.
live
Yeah,
even, right? You
that
get
too.
7 more years if you have a positive outlook on aging, I heard.
Yes, that's right. That's
Yeah.
true.
Yeah.
And while I'm there, I got to get another thing out of my system.
Go for it.
uh, Everyone doesn't have dementia that's over
Right.
65. I mean, I have things I can't remember sometimes.
Right.
And it's not, oh, they're relapsing to a child. No, it's another stage.
Mhm.
It's a brain, like they they just it's just so much that folks don't understand. And
Mhm.
respectfully, I always stop people and I try to, give my little elevator speech. But no, I'm not going to treat or talk to you as a child either,
Mhm.
even with a dementia diagnosis. And
Right.
I see how people don't honor or respect people when you get the elder speak, as they call it. Oh, do you want a little more of this, hon?
Yeah.
We got to
Right.
stop. We got to
I don't
stop
wanna
that
be
stuff.
talked to like
No,
that. Right.
no. It's everywhere. And I just try to politely say, you don't have to talk to her like that. Like my mother-in-law, we had we had some home health agencies staff come in. I asked if they could take her for a walk in the neighborhood, and she's going arm to arm with her like she can't walk. I'm like, nope,
Yeah,
that's not
she can walk.
necessary. She can walk. Like she has cognitive impairment. She can still walk, okay?
Right, so let
Like
her do what she can do.
exactly. Thank you. So
Yeah.
and even my mother-in-law, you know, she would always ask me to get things, or I'm like, well, you're not in a rude way, but I'm like, well, you could do it, you
Get
know?
your steps in today.
Exactly. I'm like, hey, as much as you can do, I want you to do it, you know?
Right.
So I don't even know how I got there, but I had to get that out of my system.
No, that's really good. That's one of the things that you'd hope
Yeah.
people understand about aging, and appreciate hearing that from you, Dr. Cross, because you know
Thank you.
these things and can remind us of that. This has been a great conversation. If there was one last tip or thought that you'd want to leave us with, what would that be?
Yeah, I would say I've been ringing the bell for this entire and talking with you, this conversation. Aging's not a crisis. It's a
Mhm.
continuum of living, not dying. Caregiving isn't just a responsibility. It's it's part of the infrastructure that makes living and aging possible. So if we can, recognize caregivers as part of that, those core members of our healthcare and public health ecosystem, and not just these extras who provide unpaid care, I think we can really help design systems and services that support both sides. So I would leave with that.
Excellent. Such a powerful reminder and very encouraging. We can do this together.
Thank you.
Thank you so much for joining us today, Dr. Cross. It was great to have you.
My pleasure. Thanks for having me.
Hello and welcome to your Medicare Minute. My name is Val Guzman and I'm the Benefit Access Specialist here at Age Guide. Today we're going to talk about how we as SHIP counselors handle your private and sensitive information when we assist you with anything that is Medicare and Medicaid related. SHIP counselors are part of a government-funded Medicare counseling program, and that means we're an unbiased resource that takes steps to guard any private information that you share with us. We do not share your information with anyone else. When you meet with a SHIP counselor, you'll meet in a private area so you can feel secure when discussing your health coverage. SHIP counselors are also available by phone, so you can reach us from the comfort of your home. Visit ageguide.org to get connected with a SHIP counselor or call AgeGuide at 1-800-528-2000.
Thank you for joining us on The Age Guide, where we explore how connections, stories, and proven strategies can help us thrive as we age. To learn more about how Age Guide Northeastern Illinois is advocating for older adults and caregivers, visit us at ageguide.org or call our offices at 630-293-5990. And if you enjoyed this episode, please share to help others find us. Join us next month as we continue exploring the science and stories of aging well.